first trimester ultrasound scan is to establish the diagnosis of pregnancy, to check for a localization of an intrauterine sac, to see for the embryo, to establish or assess the exact gestational age of the pregnancy, to look for early first trimester abnormalities of the fetus, to assess the viability of the fetus, whether the cardiac activity is present or absent, and to rule out ectopic pregnancies, and also to assess the basic anatomy of the pregnancy. And one of the most recent advances in the first trimester is NT scan, or the nuchal translucency thickness scan, which is used to rule out chromosomal aneuploidies or chromosomal abnormalities, cardiac defects and genetic syndromes. Anomaly scan, or the targeted imaging scan, or TIFA scan as it is usually called, is performed during the 18 to 24 weeks of pregnancy. By 18 to 22 weeks, almost the whole organ formation of the fetus is completed. So we have an exact comprehensive evaluation done by using a TIFA scan, so that any congenital abnormalities can be made out in the ultrasound. And according to Indian MTP Act, the termination has a legal cutoff at 24 weeks. Suppose we have any fetus with abnormalities which are not salvageable, before 24 weeks we can take a call for termination of pregnancy. Normally during pregnancies, around 28 to 32 weeks, we assess the growth of the fetus by using a well-being scan, or called the third trimester growth scan. In this scan, we are measuring the biometry of the baby, how is the growth of the baby, how is the fluid surrounding the baby, is the growth appropriate according to the gestational age of the normograms, and how is the blood flow patterns to the baby. Being complicated with the medical disorders like diabetes, hypertension, or if the baby's growth is on the lesser side, growth restricted fetus like we call it, we do clinical weekly surveillance of the fetus by using these scans to assess the growth and take the call for delivery accordingly.